So you have some notepads or pieces of paper near you. If you have any questions you want to ask our panel, please pass them over to your left, and Diego or somebody will collect them, and then we'll see if we can ask them the questions from that. So they're on the tables. That'll be the easiest way to do it. And so thank you all for amazing presentations. And from the days we used to, just for women's nutrition, pink it and shrink it, okay? We've come a long way in research with creatine in women's health. And before I say, Dr. Sue Kleiner, we miss you. Thank you for joining us from Seattle, early in the morning, I guess. Very good.
4 in the morning here.
So everybody's clapping for you to thank you for joining us. So since you're so far away and got up so early for this, why don't you start us off and give us some perspectives. You talked about translating the science through marketing strategies. What would you tell the researcher? Because we're trained to do science. We're not trained to do social media. We're not trained to do PR. We're not trained to do media interviews and podcasts. But you've worked a lot with marketing of various nutrients and different companies. What perspective? You're probably one of the best people to talk about how to translate the science to the average person. What perspectives would you give the rest of the scientists here of what we can do to better educate the public?
Well, thanks, Rick. And it is an honor and a privilege to be here today. Hopefully my creatine is working overtime from 1 to 4 in the morning, but at least I don't have jet lag. So first of all, I think that the comments from my fellow panelists today, my sister panelists, really did a lot of guidance for the kinds of questions that I wish scientists or that scientists are beginning to ask and answer that are specifically pertinent to our female consumers. That's sort of was my ask also. How can we have data that helps answer the questions that our consumers have and the solutions that they are looking for? And the list is long, and the idea, as Dr. Brown just said, could we have strategies that are preventive? Could we begin early on for young girls and women that are protective and preventive as they age and they continue to age healthfully and stronger? And so whatever those questions might be, that we have the tools to begin to answer. And I mean, that's the other thing, is it's not just always the specific data on the physiology, but it's also the application. And so Abbie mentioned, when we think about finished products, what could we combine with creatine to get a bigger bang for the consumer buck? Creatine plus electrolytes, creatine plus citicoline, creatine plus. What other ways can we get interesting outcomes, even if we don't necessarily understand the foundational mechanisms underneath? And as a scientist, I hate to say that, but in order to move things along in the product space and understanding delivery mechanisms, we're jumping ahead to gummies and jumping ahead to RTDs, and we don't necessarily have the best technology and methods to deliver the best quantity and quality of creatine to the end consumer. All of these questions are really important. And so if we want to jump ahead and get some data on outcomes that we may not understand the underlying basic mechanisms and physiology, sometimes that gets buy-in from the product development side.
Very good, thank you. Anybody else have a comment about what you can do? Let me ask you, what are you doing to help promote creatine for health? Yes, please. Good.
Maybe I can add my 5 cents. First of all, thanks for having me. I'm not a scientist, so I'm honored to be here in this round, and especially on this panel. And I truly appreciate it that at this conference we have this female life cycles. Because I remember like my first Vita Foods. It's a raw ingredients fair it was in Geneva. Now it's moving to Barcelona. And the first time I was there was 2019. They had female health, and I was just starting my company. And I asked them, "What do you have for female health?" And they taught me about urinary tract infections. That was the only thing when it came to female health that they had. Last year, they started to have female life cycles, so something is happening, and I'm so happy because when I started my company, we are about menopause, so we are serving women with educational programs and nutrition and supplements starting from the age of 40, and we are educating them. And back in 2019 in Germany, there was literally nothing. So we are like moving step by step, telling them what perimenopause is, what to expect. We launched our creatine product in November. And what I realized so far is all the question we became in the beginning was like, oh my God, do I get bulky? Do I get water retention? Is it dangerous? What's happening to my kidneys? They confused it with the hair, with everything. So. And now, half a year later, not even, we are seeing more because I was asking them some questions in advance of the conference, and the questions are getting more particular. So it's really nice. And the product feedback that we're getting is a lot about, my energy is improving, I feel better. And we in Germany are not allowed, like in the States, to make all this like great marketing remarks, because the only thing I can say is that you can use creatine for muscle improvement combined with sports. So it's really a challenge for me to kind of like put it in a way that women understand it and no one is kind of like taking off my product, because it's really, you get all these fines when you have like healthcare statements. So, but I'm playing around a little bit with it, and I think kind of like addressing the needs that women have to finally come to your question. Because, like, for example, my reason was to take creatine was because of osteopenia, but that's me. I'm a little bit nerdy in this regards. For most of the women, they want to see changes in their body composition and energy levels. So I think from a marketing side, we have to address those changes, and then we can be happy that their muscles and their bones and all the other things improve. But everything is like, when it comes especially to menopause, it's about sleep problems, it's about energy problems, it's about not functioning in a cognitive way, and addressing those things that women can feel is really helping from the consumer side. Because if I tell them like your muscles getting stronger, they're like, yeah, I don't want to get bulky, you want muscles. So, and I'm always telling them you can get up from the toilet anymore. So they, in a way, they know it, but the most imminent problem for most of them is like their weight, their appearance, and I think addressing those and taking all the other benefits with us is a really good starting point to promote creatine and protein and all the other great supplements that are out there.
Dr. Smith-Ryan, I'm interested to hear your concept of what's it going to take to get information to women to make sure that they understand it's creatine's for women too.
Well, I have a couple thoughts. One, as a scientist, my favorite thing is to create research that has that direct translation, which is sometimes not the most respected in the field, but I think maybe is the most impactful. And then I always say you're doing your best when you're most uncomfortable. And so working and having the conversation, I hate social media, for the second time I'll say that, because it paints this perfect picture. And in reality, like, every day is kind of a hot mess in my life. But working with the influencers, going on podcasts, or having conversations with people like Peggy to really understand what are the questions, and then developing science to answer those questions, and then that two-way communication. You mentioned we don't have training, but maybe it's my simplistic brain of if we can utilize our life experiences and have that conversation, I think it brings to life a little bit of the science, which I think is important.
Dr. Ellery, you've gone from pregnancy and the medical potential application. What are your considerations to help the medical practitioner maybe adopt creatine for women's health? before birth and even childbirth.
Yeah, it is certainly a challenging space, particularly because most creatine products have the little pregnant lady with the cross through it, and that's a really big, image that people can't get out of their heads, and it puts an end to the conversation before it even begins. I completely appreciate why that is there. Pregnancy is an incredibly challenging space. As I mentioned yesterday, obviously you're dealing with two people, not one, and there's obviously a lot of history behind drugs being introduced into the pregnancy space that shouldn't have been, and some really detrimental outcomes. So it is very challenging. To me, what it needs to be is it needs to be consumer driven. We need to engage with our participants, our women. We need to understand what their wants and needs are, and what their wants and needs are in terms of safety and efficacy data. I mean, in some ways for us, it's actually, the safety data is almost more important than the efficacy data. We want to see that it's efficacious, and if it is, brilliant, we'll keep progressing it. But safety is the number one, particularly with a supplement that is being suggested as being used antenatally. Pregnant women don't care about themselves, they care about their baby, and we need to make sure that we are reassuring, generating as much data as we can, being very open and honest about it. But also, I guess it's our voices being heard and not some random... I hate social media personally, and it just, it grinds my gears that you can get up there and say whatever you want when you don't know anything about these things. But I guess it's us putting on our big people pants and saying, okay, well, we actually do know some things. We'll level with you. This is what we know. This is what we don't know. This is what we're doing. Take that information and go with it. But don't listen necessarily to that person over there. But it's really challenging. It's really challenging.
Dr. Brown, any thoughts?
I just have one last quick thought that adds to everyone else's, is knowing your audience, I think, is really important, right? Because we've talked about so many different categories of females throughout the morning. And the way that you deliver information to a teenager is absolutely different than you would deliver to a pregnant mom or someone that's elderly, right? So knowing your audience, but I guess that's just kind of a life lesson in general when you communicate with humans. Like, who are you speaking to? Take into context who the person is in front of you before you decide how to deliver information.
So back in the good old days, in 80s and 90s, we just had fitness magazines. And I used to be frustrated because I'd read these articles from supposedly knowledgeable people, and they didn't have any degrees or whatever. And several of us said, we got to change that. And we started contributing articles, and it had credentials, and it was the actual science, not just marketing piece. And I think that's really important. As scientists, we may not like social media, but that's how we communicate. You look at altmetrics, how many articles, there's more impact from the altmetrics and people seeing articles and then getting it viral than there is anybody ever going to read an article out of the journal that we do. And so impact. And so I think maybe in our doctoral programs, we need to train our students how to do social media. And one of the things we've done is I've got a social media director. Where's Sarah? She's on top of the social media stuff I've never heard of, but they're pushing things, okay? And so maybe getting some of our younger, savvy students that are on this might help us to get the communication out. And I'll talk a little bit more about it Saturday. So next question is pregnancy. Fascinated with pregnancy. Natural labor is muscle contraction relaxation.
Yes.
Creatine loading improves muscle contraction relaxation.
Yes.
Are you aware of any studies, or are you thinking about studies to look at, we talked about maybe having a third trimester and the 4 or 5 grams a day. What about creatine loading before natural childbirth?
So on that door there to the right, there's a poster on the other side, which is a nice little study that I just did with some colleagues at Vanderbilt Medical Center I think they're in Tennessee. So they're uterine biologists. They have incredible setups to take human samples and also mouse strips of myometrium and expose it to different drugs and then test the contractile force behind it. So the initial data from that is on the door there. It's not particularly promising, but having said that, this was our first stab at doing an in vitro supplementation of our tissue with creatine. We had to make an educated guess about the dose of creatine, so we used a 5 millimolar media for the supplementation, and also because of the nature of the human uterine strips, we could only keep them sort of alive for 24 hours after being taken out at cesarean delivery. So the level of exposure time to the creatine in the media is only around 18 hours. What we haven't done yet is actually measure the creatine uptake in those tissues. We did put D3 creatine into the media so that we can do that, but we just literally have just plugged the data that's on that poster there in the last week or so. So I think it's a really interesting question. It's something that we're definitely interested in. Initially not looking quite there, but the caveat being not sure that that experimental design is giving us an answer that is 100% yes or no at this point.
Could you potentially do something like monitoring contraction time and severity during childbirth with creatine versus placebo or something?
Yeah,
to see if that changes the dynamics and response?
Yeah, we certainly could. This was kind of the first step of if we in an in vitro setting where we can actually kind of control the parameters really tightly, do we see a difference? And then we could, yes, always go to looking at a trial. Some data that from that study that I didn't present today that hasn't been published yet, but I'm hoping will come out later this year, is that we also saw a difference in creatine concentration in the venous cord plasma depending on the mode of delivery of the baby. So our elected cesareans, they're a lovely little like control population because they don't go into labour at all. And so if we look at the creatine levels in the cord blood of those deliveries versus those that have had either a vaginal unassisted delivery or an emergency cesarean section, so have laboured and then things are going really poorly, they make the decision to get the baby out quickly, or an instrumented delivery, which is just another way in which they can decide to whip baby out really quick because things aren't looking good. The creatine concentrations are different. So there's definitely something happening there in that labour space. We just need to explore it a little bit further.
So another question I had when I was listening to your talk was you mentioned that creatine concentrations change with hypoxia, and you were surprised that maybe there was more creatine. Isn't creatine broken down from phosphocreatine, so there's more creatine, maybe more PC was being used to help generate energy?
Yeah, potentially. So something that I didn't clarify with our data though is that that's total creatine is the creatine and phosphocreatine pool. So I never present it as the creatine to phosphocreatine ratio though, because as soon as you take a tissue out of the body, the majority of the phosphocreatine, as everyone in this room knows, unless you're taking a good muscle biopsy that's snap frozen straight away, you're losing the vast majority of the phosphocreatine. So we did see some variations in the ratio in some of our tissues, and our sampling protocol is pretty stringent, but I'm hesitant to talk to that because of that caveat of a sampling error likely being involved.
Okay, great. So I got a question from the audience for everybody. Would you recommend that female teenagers take creatine every day? Dr. Kleiner, do you want to respond to that as a dietitian?
Well, I'm not the scientist in this particular area, and you have several on the panel, but when we work with youth athletes, we evaluate their diets, and as Dr. Brown said, we look to enhance food first and try and enhance their dietary intakes across the board. The benefits of increasing animal protein in their diet, especially young women, gives them so many benefits, not the least of which iron. And so that, we look at that first. Then if there's a strategic benefit, Dr. Smith-Ryan has shown that there is enhancement in strength and performance. If I'm speaking to an athlete, there certainly is justification for supplementing with creatine. But across the board in all young women, adolescent women, I think if I, had my own 2 young women at home that were still early on, I probably would give them some creatine myself, but I'm not sure that I could make an evidence-based recommendation for that today.
Okay. Other thoughts? Dr. Smith-Ryan? I'll put everybody on the spot.
Well, I'm going to revert back to the last question about pregnancy. As Dr. Ellery, I'm not an expert, and I'm so inspired by what you're doing. But I do think taking evidence and application and making everything we do as a risk to benefit ratio, even with this question. And so I wanted to give a pregnancy perspective with evidence that I think pregnancy is the most athletic event you'll ever do. And I was also a collegiate athlete. And I say that, I took creatine, and I have 2 boys. I also trained like it was an athletic event. And I say that when you think about creatine during pregnancy, should I eat 6 chicken breasts, which I have no appetite for or room for, or 5 grams of creatine is actually potentially quite beneficial when thinking about an athletic event. And so it goes back to the pregnancy question of and leads into the adolescent question of what's the risk to benefit ratio. I believe that we should try and get whole foods first. But then most women are under consuming calories in general and protein. So would 5 grams of creatine be potentially beneficial? Yeah. What's the risk? There's very little. And so if you've had some of those conversations, I think the benefit probably outweighs the risk and has some evidence behind it. Do we need more work? Absolutely. I fortunately have 2 little boys at home, and not little girls, but especially if there's an illness or post-flu, I might give them a little creatine here and there. And then as they become more active and it's harder to get those calories, it's something I would consider.
Anybody else have a comment?
Only to say that labour is something that I am becoming really passionate about, because I like to position it as, there's been so much bit work in the exercise physiology space that you have a marathon runner, you have that person on a 6-8 week program in the lead up, everything is timed down to the precision when they're going to have glucose, when they have protein, when they have this. Throughout the run, they will intermittently take different supplements, water, it's all timed because we understand the physiology of that kind of endurance exercise. We have absolutely no understanding of the metabolic changes that happen during labour. I've just received a series of samples from a colleague in Queensland, Australia, who took serial blood samples from women whilst they were labouring for a different question. But I was like, oh my goodness, can I please have those samples? And the plan is to do a full metabolomics screen on those samples so that we start to understand what the energy expenditure is, where that energy expenditure is, how should we actually be tried to support women through the labour process, so that they don't look back on it and think that it is one of the, it's always going to be challenging, but it should be a positive experience. And unfortunately for a lot of women at the moment, labour is not a positive experience, and it would be good to be able to change that.
So let me add my perspective. I kind of agree with Dr. Smith-Ryan. What's the risk benefit? If we know creatine has lots of benefits during maturation in kids, the minimum goal should be getting at least 1 gram a day in your diet, hopefully, right? Because all the NHANES data, that 1 gram seems to be about the threshold. And if you get it up to 2 grams, you even have a little bit more benefit. So then the question is it cost effective to go eat, 10 ounces of salmon, spend $10, or 15 cents for a little scoop of creatine, then it's a matter of cost effectiveness. So if you look at the recommendations for 2010, it's 3 grams a day for everybody. I think the data is even better now and showing, yes, we always want more data. We're always very hesitant, but eventually we have to say, this seems all the data shows safety, all the data shows it can be effective. Maybe it's something we should do. Dr. Brown, go ahead.
Just wanted to add one thing. I see it also a little bit as a safety net. Of course, whole foods first, but I also take multivitamins just in case I happen to not be able to find lettuce where I'm traveling, or, like, it's just kind of a nice backup just in case I am not able to get it in through Whole Foods every day. And then just on a personal note, my little 6-year-old daughter had a traumatic brain injury when I was pregnant with her. And so she loves the gummies too anyways. It's a pretty easy one for a little kid to want to eat a creatine gummy, but I definitely give her creatine.
Very good. So I had a comment sent in from the audience saying that there is a Vita Foods event coming up in Barcelona, Spain, and they have a whole session on women's health to focus on for food and dietary supplements. So obviously this space is really expanding for, even when we did our curves research, we developed specific supplements for women. There were nothing out there that was just focused for women. I think that's a huge opportunity for companies to develop formulations specific for women to optimize health throughout their lifespan. And creatine's got to be part of that.
Can I add one thing?
You may.
I was just going to say, okay, one thing, I think this is something obviously I'm really passionate about, and we're making a lot of progress. I also think the industry is making it more confusing, because now there's all these products for women, but they're not providing the education. And so I think it's a really big opportunity to say, here's actually, tell me more about my health and what the product is supposed to do, because women really thrive on that education. There's a lot of data to support that. So instead of just making new products, really leveraging the opportunity to improve health and quality of life and speak to the consumer.
Very good.
Well, and that, just Rick, if I could jump in, that educational component in the marketing, as I mentioned, is reflected in the sales data. The companies that invest in education are more successful with women in particular.
Well, one way is it builds brand loyalty because they feel like you're getting honest, accurate information and make an informed decision. Yes.
Yeah, maybe I can jump into that, because this is exactly what we're doing. When I founded the company, I stumbled myself into the menopause space, and I thought I knew that what it is, and I thought it's hot flashes and you're like 52 and your period stops. When I jumped into this rabbit hole, there was a whole world opening up. And first, I remember, it was in 2018, I was researching for the company, and I felt like I had 2,000, loose ends. And then I got them together, and then you finally see, okay, it's nutrition is the basis of everything, and it falls into place. And we have to tell women because they don't know. So we did a study, when we started the company with 2,000 women. We asked them, what have you ever heard the term perimenopause? And they were like, no. 88% said no. They had symptoms which were clearly connected to perimenopause. They had no clue that it was perimenopause. They had no clue how to treat them. And since then, we really, and I know social media, it sucks. It's a lot of points because there is a lot of misinformation. I recently read that a fitness trainer was recommending to her patients 3 to 4 grams of creatine per kilogram body weight. And I was like, whoa, that's a lot. So I think she kind of got some points wrong. So there is a huge source of false information, but it's also a great opportunity to educate women. And we do a lot of Insta Lives with experts. I was lucky to interview some of you guys. So it really helps to bring the message out there. And so we are targeting older women. And it was for us, COVID was really, really lucky because they finally use Zoom and all the social media tools. And it's for us as a brand, we get a lot of feedback, which we can use to develop the product. So it's really like a cycle. I can tune my communication accordingly because I can I think, and you said it, I can find the language that the women talk, because the language is different for like as 18-year-old, because she has totally different points than a woman who's like 55 and just went through menopause. So this is like a super important point, to have this communication, to listen to your customers, and to develop products that really help them, but also not only the products, but why are they taking it? So why should you take creatine? What is it doing? What is physiological and psychological happening in your body? And it's super essential. And as you said, it's really success parameter for a brand that wants to be there long term.
Great, thank you. So another question from the audience is, if creatine has influence on melatonin, can creatine play a positive influence on cortisol? So to give background, cortisol, stress hormone.
It's a great question.
Yeah, stress hormone and linked to obesity and inflammation things. So, Dr. Brown, you have a comment?
No, not really. Stacey gave me the mic. No, I have not researched that, and so it seems like a unique space to go into. I mean, I have absolutely no idea. Cortisol, we would anticipate, would be also elevated. The cortisol awakening response is elevated typically in those with diagnosed anxiety. So that'd be an interesting marker to look at, especially if you're working with a population that has a diagnosis of depression or anxiety. But I actually do not know the answer to that question.
So one of the potentials is to combine creatine with some things that reduce cortisol. And there's a whole area in sports nutrition on pre-sleep nutrition to optimize recovery. If you sleep, have a deeper sleep, longer sleep, growth hormone, lots of really good things happen, right, for recovery. And so I see that where a potential of combining some things. And if melatonin actually helps you sleep more, you should have more growth hormone, you should have less stress. And there may be some combinations that be a great area for future research or development.
If it's pre-sleep related, I think that should be a Mike Ormsby study, not myself.
Very good. So another question.
Well, and if you want to, Rick, for 1 second, if you want to get into social media, right now, one of the hottest things out there is the anti-cortisol diet. People posting cortisol face, all kinds of, there's no data behind it. It's a new fad. It's all over TikTok. But it is an area that clearly consumers are starting, younger consumers are starting to express as a concern, particularly associated with anxiety.
Well, I can tell you that if you give acute creatine in recovery, you do see tendency to be cortisol less and less muscle trauma. And so a little bit faster recovery. So maybe there'd be something to combine some better sleep aids with creatine in the diet to maybe enhance. So another question is, what about creatine and fertility?
That one for me. Yes, very interesting question. So the reason why it's interesting is because if you go back through the literature, there is a scattering of creatine measurements, studies in, sperm have their own creatine transporter. It is a specific creatine transporter not expressed by any other cell in the body except for sperm. In the follicular fluid and in the fallopian tube fluid, around the time of ovulation, there are higher creatine levels. Is it there for the sperm to have that hyperactivation to get to the egg? Probably, but no one has seemed to put all of the pieces together and pick it up as yet. But I think it would be incredibly interesting to see whether you could change particularly sperm motility, but also the level of whether you could get improved outcomes in an IVF space in terms of how many eggs actually fertilized, got to the blastocyst stage, got to having a good AA reading at a blastocyst stage before it's being implanted again. There is definitely little pockets of information to suggest that it is worth pursuing further. Just no one has done it yet.
I've seen a couple studies where they've added creatine to the medium for in vitro fertilization, and the sperm swim faster, it's a little harder, and seem to work better. So whether that makes a greater impact on the positive fertility impact, et cetera, needs to be looked at, but very fascinating area.
Absolutely, yeah. I mean, it's tricky. I was having a conversation with one of our colleagues in the audience just on the break, particularly on this topic. It's an area, if anyone wants to get into it, that needs good science, because the problem is that you're working with a highly vulnerable population of men and women who are desperate to have children. And there are a bunch of add-ons associated with artificial reproductive technologies. And from a conscious point of view, I wouldn't want to introduce creatine as an additional add-on without the good information, even though from a risk-benefit perspective, even now, it's probably worth having a crack. But I feel like it's a protective population that we need to be very conscious of the situation that they're going through, and let's get some good data behind it before we make those recommendations. But we should definitely do it.
And if I recall, in our Creatine for Health paper, we had a little section on fertility, and there was one paper that showed that sperm count was increased in the men that had a low value. So I think there's wide open space potentially to look at some of those areas. Pretty fascinating.
Yeah, absolutely.
Okay, other questions, comments. You had a slide that talked about future directions. Was that you, Dr. Brown? And Abbie, where do you want to see women's health and creatine go? In social media bit, short description, where do you want to see it go? What would you like to see happen?
Who wants it? Who wants it?
We have influencers, we have people that are with industry watching us and developing, looking for ideas. What would you want to tell them?
I was going to respond to the first question, the first version. I think in the directions that we are currently going, we just need more of it, would be my first response. And to Abbie's point earlier, it's really hard to move the needle when there's only so many of us doing female research in creatine. So the more collaborations that can be formed, I know that the reason why I was pulled into this work is because of incredible friendships that I've made over the years. So finding the people to work with to initiate just more research in general, because there are endless questions to ask, and each of us independently can't ask all the questions or answer all the questions. So the more of us doing the work that's currently going on would be my answer.
So more funding.
Perhaps, yes. Oh, we have a job opening, by the way, in our giant grant if anyone wants to move to Idaho.
Funding not just from government sources, but from industry, please. Yes. Go ahead.
Totally biased, and I loved what Sue presented. I also feel like this space is promising a lot, where women are. I think perimenopause is a very vulnerable space where women are dying for help. But creatine is not going to solve everything, and so really taking an evidence-based approach. And I really think when you look at the literature, besides some inside info I got yesterday, there is no data in perimenopause with creatine, and we need that to know really how much or what effect to have. And it was a really important life stage that's going to impact the men and the women in the room. So arguably perimenopause is a really important next step.
I would immediately publish all your research all over social media. And my wish would be to have a health claim when it comes to mental health cognition, because that would really, really help me in Germany, not to kind of like, sail around to what is the benefit of creatine beside muscle, but really to have a health claim, because I mean, the evidence that we saw in the last days was really solid in this regards, much more solid than on bones. So I think there needs to be a health claim that would be helpful.
Dr. Eller?
Yeah, I mean, I don't really have very much to add other than the wonderful comments that were just made there. I think initiatives like this are the way forward in terms of making sure we can get past some of those, earlier myths and misconceptions, for lack of a better term. I mean, I still get them every day, and I don't know how you get around somebody Googling creatine for the first time and having that stupid Lancet paper pop up first. Like, I feel like we've been doing our best to really try and get the newer evidence out there, and yet for some reason that's got some little special shiny glitter on it that makes it just pop up first and really creates concern for people. And so I think it's a matter of, being our honest selves out there, being scientists, give people the data. Don't assume that they're not going to understand it, or that you need to sugarcoat it, or it needs to be that, for us, your baby's never going to have any complications if you had creatine. That's not the case whatsoever. But we can show you this, and this is where there's potential benefit, and this is the level of potential benefit that you see. Take people along for the ride, respect that they understand what you're saying, and then that's how you build trust in what you're doing, and you hope that you become the voice that they want to hear as opposed to other people that they might be listening to.
Dr. Kleiner, thoughts?
Yeah, I think dosing is going to be very important to know that the specific benefit that you're looking for, the consumer's looking for, or you're studying, that we really start to focus in on what dose is required to get the benefit that we're looking for. Because too many times with too many products over all the years, the industry has focused on whatever the lowest dose was in one single study, and that's what they promote because they get the biggest bang for their buck by putting in less of the most expensive ingredient. Well, fortunately, creatine is not expensive, but in any case, having people take too low a dose and not have a benefit turns them off. Whereas, so women are being promoted very often. I see, they're eating 1 or 2 gummies, and so that's giving them 1 or 2 grams of creatine, and then they don't get any results that they're looking for, and they say, well, this just doesn't work. And so I think having, as scientists, promoting as much knowledge as we have on the specific dose for that benefit, for the age, for the size of the woman, making sure that that dose is appropriate. And then as we continue to do research, be looking at multiple doses if possible in studies so that we can know what is the most efficacious dose for the benefit.
So another quick question, about 3 or 4 minutes. It may have been Dr. Smith-Ryan mentioned the run-in phase. Was that Dr. Brown? Okay, run-in phase. So this is a kind of pet peeve with creatine research. If you take low dose, 3 to 5 grams a day, it's going to take you a month to get 70% of the creatine stores that loading would do. That's what the initial research showed. And if that's the case, you shouldn't really start your intervention until 6 weeks into the supplementation if you're going to do the low dose kind of approach, or you got to make sure you load. And so in women, it was mentioned that they're more apt to like the lower because they don't want to feel there's any loading, even though we'll show you on Saturday, there's no data to that. But is that an approach to be considered, that maybe we should come up with some guidelines for doing research in women's health and nutrition with creatine specifically to help inform the other researchers? Because there's right now, of the 700 or so clinical trials, about a third of them included women. There's just still a lot more that needs to be done. But what would your recommendations be as far as protocol or lead-in phase, et cetera?
Yeah, it's a great question. And I think we all, as researchers, there's so much that goes into planning a study, particularly with compliance. And you're exactly right. Like, the best way to get creatine levels elevated is to do a loading phase. And so that's exactly what we're doing, is a loading phase followed by a daily dose. It would be great to understand more about a daily dose, but in reality, it takes much longer. And research already takes a lot of time, but I love the idea. I never thought about creating some guidelines around that, or even guidelines around leveraging the menstrual cycle, because it is still, it seems to be black and white, but it's not. So yeah, I think you always have to account for time and money, and more importantly, I do think when evaluating females, there are a bit more time demands that go into consideration when scheduling. So there's a number of things at play, but absolutely, like that's exactly why we're doing a 1 week loading run-in phase followed by daily dose for a 6 weeks training study, so that we don't take now a 6 week intervention out to 12 weeks to be more impactful.
So recommendation when you guys are working on your paper summary of this session, add a box or something about recommendations for future research on creatine in women so they can see the design. The late Dr. Kreider did a great paper on sport nutrition characteristics for good quality studies. If we had that for women's health studies from the leaders who are doing this, that would really help inform a lot of us that are doing some work with women to make sure we hit all those items. Okay. Last question. We haven't talked about PMS. And back in the 90s, before Alzchem was Alzchem, it was back at SKW days, way back, they had some survey data they were getting from women that they were reporting less severity of PMS symptoms and cramping, et cetera. We actually tried to do a study, but the lead-in to qualify women to actually have PMS was so demanding, it just got to be difficult to get the participants. Is that an area that you think is ripe for potential research?
I mean, personally, yes, I highlighted a little bit in my talk. I don't know if creatine by itself, but absolutely. I think it's an area that is ripe for so many things because it's, one, so detrimental, and there are some key things that would be helpful. So absolutely. And I don't know what year you started that, but I think a lot of women, no one talks about PMS because, oh, she must be on her period. When in reality, it's like, yeah, she's on her period, give her a break. All right, so like I think more women know what PMS is and how to quantify it. And so I bet now it would be better and easier to do, and it's a bit more less taboo. So I'd be interested to pick your brain on some of the methods.
We'd be happy to share the protocol that we came up with. We were working with the University of Tennessee, Memphis to do it. I think it's a great opportunity. Dr. Brown?
Yeah, so I just wanted to add to it. So Fiona Baker, who does a ton of work in sleep and the menstrual cycle and how both are impacting one another, that would be something that I would change in my protocols moving forward, is to actually do an assessment of PMS symptoms along with sleep disruption, because they are absolutely intertwined and interact with one another. So if anyone is interested in PMS, also maybe do some kind of perceived sleep quality and vice versa, because those two are deeply intertwined.
Well, thank you so much. Join me in thanking our esteemed guests and speakers today. It's a fantastic session, very important, and hopefully the next time we meet, we'll be even farther along the understanding of how creatine can improve health and quality of life in women. Yep. Thank you.